afternoon, New Brunswick, and welcome to today's COVID-19 update for the province. I'm Vicky Hogarth at the CHCO News Desk. We will be hearing today from Dr. Russell and Minister of Health, Dorothy Shepherd. We're still waiting to do roll call. I imagine it will take place in the next minute or two. So if you do hear a slight interruption, that's because I'm just waiting to do roll call on the line with the rest of the journalists. Now, some new information that was shared over the course of the long weekend. A person under the age of 19 and under in that age group, so the first child in New Brunswick, has been hospitalized due to the virus. So I'm sure there will be an update with regards to that situation, as well as the number of hospitalizations in general. As of yesterday, there were 56 New Brunswickers in the hospital with COVID-19 and about 20 in the intensive care unit. There were 98 new cases of COVID-19 in the province yesterday. There are 1,037 active cases of COVID-19 in total in New Brunswick right now. And as you know, those numbers change at the start of the conference when Dr. Russell does tell us the new case count. In terms of active cases, though, let's just go over by health zone where they are. There are 375 active cases currently in Zone 1, that's the Moncton region. There are 75 in Zone 2, that's right here in the St. John region. There are 238 in Zone 3, that is the Fredericton region. Obviously, for many of you who are part of the circuit breaker that affects part of Zone 3, there is a map online available on the GNB website. I'll get to that in a second after I finish the case count roundups for each health zone. There are 165 active cases in Zone 4. 99 in Zone 5, 50 in Zone 6, 35 in Zone 7. Now, as I was mentioning, the circuit breaker, many of us, for instance, right here where I am in St. John region, the Zone 2, had a circuit breaker over the course of the long weekend that started on Friday and ended last night at midnight. But there are still 3 other parts of the province, all of Zone 4, I'm going to make sure I get this right, parts of Zone 3 and parts of Zone 1. If you do live in Zone 1 and Zone 3, I'm sure you have checked already, but there are maps available on the GNB website that show exactly where in those health zones, because they did draw the line differently. It's not the full zone in each case. There is a roll call just taking place right now, so I'm just going to pay attention for Arnie. If you can hear Bruce in the background. Just 1 second. My apologies for the interruption. It shouldn't be too long. I do believe I'll be...
She's 93. Oui, présent. Vicky Hogarth.
Here. There we go. Okay, I'll just turn down the volume on that, but it will give you an idea as you hear Bruce McFarlane. He is our regular moderator that you've been used to for the past over a year and a half. He is doing the roll call right now, so I imagine he will be also leading the conference today. It does sound like, just from the start of this, that there probably will be quite a large number of journalists on the call today. So whether that means we have one question that we can ask or two, I did receive a lot of questions submitted from the public. One just based on people I was speaking to this morning on Campobello Island about the rapid test initiation of those in the school system. So I'm sure Dr. Russell will speak to this a little bit today, and Minister of Health Dorothy Shepherd as well. Rapid tests are now being implemented in the school system. Now, this is specifically for children who are not eligible to be vaccinated or for unvaccinated students. So basically what it will mean, and I'm sure there will be more details, is that if you are a close contact of a person with COVID-19, particularly as we're seeing more cases in the school system this year with the Delta variant at play, it's becoming more and more an issue and has caused many operational days already. We're only in the start of October, and I post every time there is one in our Zone 2 region on our Facebook page, but there have been quite a large number of operational days for schools already. So this rapid test is supposed to help with that. Anyone who is unvaccinated or yes, again, uneligible to be vaccinated, as many children in the school system are if they are under the age of 12, can get a rapid test kit from the school if they are a close contact of someone with COVID-19. And they will have to give 2 negative COVID-19 tests taken within 24 hours if they want to go back to school. Now, this can happen over a 24-hour period. So you're given I do want to hear more details. I am trying to understand it myself, but you are given a bunch of rapid tests if you are a close contact, and when you are able to produce 2 negative tests within 24 hours, you can come back to school. So I'm sure, again, there will be more information about this in today's conference. Hopefully this will help with the operational days that we're seeing quite frequently already this year. Obviously, the Delta variant is a different beast altogether than we were dealing with last year when we were just dealing with the original strain of COVID-19. And as we see with this mention in yesterday's report of a case hospitalized under the age of 19, is showing you that this is definitely, while it is the same virus, it has mutated into something that seems to be affecting more and more younger people and has caused these disruptions in the school system already. Looks like we do have Dr. Russell and Minister of Health Dorothy Shepherd coming into the conference room, so we should be starting now. I will see you after the conference.
Bruce, c'est juste pour vous dire que moi, Frédéric Camarano, je suis là maintenant.
Parfait. Merci. Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bon après-midi, tout le monde, et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et l'Honorable Dorothy Shepherd, ministre de la Santé. Speaking on behalf of the province this afternoon, Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Dr. Russell.
Thank you, Bruce. Merci. Bon après-midi à toutes et à tous. Good afternoon, everyone. La 4e vague de la pandémie frappe notre province de plein fouet. Le nombre de nouvelles infections atteint des pics inégalée depuis le début de la crise et cette situation risque de se poursuivre pendant un certain temps. The 4th wave of the COVID-19 pandemic is hitting our province very hard. We are seeing a surge in new infections to levels that we have not experienced at any point since the pandemic began. This is likely to continue for some time. The public health measures now in place will slow the pace of infection, but given the incubation period for this virus, we will not see the results of these actions for a week or so. The COVID-19 virus can infect anyone that comes into contact with, whether or not they have been vaccinated. And this is clearly shown in our most recent case counts. However, our focus now is on the infections that develop into more serious illness and the ones that lead to hospitalizations and deaths. Les preuves sont claires. Si vous n'êtes pas vacciné, vous êtes 18 fois plus susceptible de tomber gravement malade si vous contractez le COVID-19. Je veux que toutes les Néo-Brunswickois et Néo-Brunswickoises soient en santé et en sécurité. Mais nous continuerons malheureusement de voir des nombres de cas records chez les personnes adéquatement vaccinées. The evidence is clear. If you are unvaccinated, you are 18 times more likely to become severely ill if you contract the COVID-19 virus. I want every New Brunswicker to be safe and stay healthy. But there are now and will continue to be breakthrough cases of COVID-19 among people who have been fully vaccinated. Aujourd'hui, Santé publique annonce qu'il y a 109 nouveaux cas de COVID-19 au Nouveau-Brunswick. Parmi ces cas, 32, soit 29%, ont reçu 2 doses d'un vaccin contre la COVID. Je tiens à vous expliquer pourquoi cela se produit, ce que ça veut dire et ce que vous devez faire pour assurer votre sécurité et celle de votre famille. Today, Public Health is reporting 109 new cases of COVID-19 in New Brunswick, and of these, 32, or 29%, had been fully vaccinated with 2 doses of a COVID-19 vaccine. And I'd like to take some time today to talk briefly about why this is happening, what it means, and what you can do to keep yourselves and your families safe. The COVID-19 vaccines are very effective, but they're not perfect. And while you are less likely to be infected when you are fully vaccinated, it can happen. The evidence to date shows that they are very good at preventing serious illness, hospitalization, and death among those infected with COVID-19 virus. When you are vaccinated, you develop antibodies that will help fight off the virus. And if you become infected, you may not have any signs of illness, or you may experience relatively mild symptoms from which you are able to recover within a week or 2. Les personnes les plus exposées au danger à l'heure actuelle sont celles qui ne sont pas vaccinées ou qui ne sont que partiellement. Parmi les 63 personnes hospitalisées en raison de la COVID-19, soit 76% ou 48 personnes n'ont pas reçu un schéma vaccinal complet. Parmi les 27 personnes qui se trouvent dans les unités des soins intensifs, 22, soit 82%, n'ont reçu aucun vaccin. The greatest danger from the current wave is to those who are partially vaccinated or not vaccinated at all. Of the 63 New Brunswickers now in hospital with COVID-19, 48 of them, or 76%, have not been fully vaccinated. There are 27 New Brunswickers currently in an ICU bed because of this virus. 22, or 82%, are unvaccinated. Since August 1st, our rate of ICU admission for unvaccinated patients is 33.4 cases for every 100,000 unvaccinated New Brunswickers. Now, if we contrast that with the rate for fully vaccinated, it is just 1.8 cases per 100,000 fully vaccinated New Brunswick residents. And this clearly shows that vaccines are doing the job of preventing severe illness from COVID-19. And I just want to thank the staff who provided those numbers and the breakdown to help frame this information for all of you to be able to hear it and understand it. If you are not yet fully vaccinated, my message to you is to get vaccinated as soon as you can. More than 81% of our population is now fully vaccinated, and 90% have had at least 1 dose. I'm particularly pleased to see that the number of people getting first doses is rising again, and this shows that our measures to encourage vaccination are having the desired effect. But that still leaves 128,000 eligible New Brunswickers who are not yet fully protected against the virus, and 69,000 who have not yet been vaccinated at all. So I am concerned about those numbers. I'm concerned about those people as individuals, and I'm concerned for their families who might be worried about them as well not being vaccinated. De plus, il y a des dizaines de milliers d'enfants de moins de 12 ans qui ne sont pas encore admissibles à la vaccination. Nous attendons impatiemment l'approbation de Santé Canada pour commencer à vacciner les plus jeunes. Même si les enfants ont tendance à être moins malades que les adultes et sont moins susceptibles d'être hospitalisés, ils peuvent transmettre le virus. There are also tens of thousands of children under 12 who are not yet eligible to be vaccinated against COVID-19. We are eagerly awaiting the approval from Health Canada to start rolling out vaccinations to the younger age group. While younger people don't tend to get as sick as adults and are less likely to require hospitalization, they can transmit the disease to others. Therefore, the more we can protect them, the more we protect everyone. For those who are vaccinated, your protection is greater, but not complete. The vaccine is just one layer of protection. You must continue to follow all the other public health guidance and advice to keep yourselves and everyone around you healthy and safe. While you may not become seriously ill from COVID-19, you may pass on the virus to others who are not so well protected. You may unwittingly infect a family member whose immune system has been weakened by disease or old age. You may infect someone who is not yet able to be vaccinated, such as a child under the age of 12. This is why everyone must continue to watch for symptoms of COVID-19 in themselves and their families and stay away from work or school when you feel unwell and get tested if you have symptoms, even mild ones. I also strongly recommend that everyone be vaccinated against influenza this fall. Vaccinations are available now from doctors, pharmacists, or through your workplace. L'an dernier, il n'y a presque pas eu de cas de grippe grâce aux mesures de santé publique mises en place en raison de la COVID. Or, j'ai bien peur que la grippe soit de retour cet hiver. Contracter les deux virus à la fois pourrait avoir de graves répercussions sur votre santé. Le meilleur moyen de vous protéger consiste à vous faire vacciner contre chacun de ces virus. Nous pouvons apprendre à vivre avec le COVID-19. While the flu was virtually non-existent last year, thanks to public health measures put in place because of COVID-19, I am concerned that it will make a comeback this winter. In fact, I was looking at the numbers from the 2017-2018 flu season, and I believe in that year we had about 600 people hospitalized because of because of the flu, and we had 50 deaths because of the flu that year. So, being infected by the flu obviously carries risks of hospitalization and death, but having the flu and COVID-19 at the same time could severely impact your health. The best protection you can have is to be fully vaccinated against both viruses. We can learn to live with COVID-19, and we can protect our most vulnerable New Brunswickers, and we can keep our healthcare system from becoming overwhelmed. We can do this if we all work together. Follow public health advice and be kind to one another. We can do it because we have done it before, and the evidence on this is very clear. Thank you very much.
Good afternoon. Bonjour. Over the Thanksgiving weekend, all New Brunswickers were asked to make a significant sacrifice. We all had to avoid public gatherings and could only spend time with our single household bubble to help reduce the spread of COVID-19. I know the majority of people followed those rules, and I want to thank you for doing your part to get us back on the right track. We have asked a lot of you, and I appreciate the work you have done to protect your fellow New Brunswickers. Between Friday night through Monday, officers and inspectors responded to 28 calls for service and conducted more than 600 inspections of stores, restaurants, licensed establishments, events, entertainment and fitness venues, and several private dwellings. I'm pleased to report that nearly everyone was found to be in compliance with the rules. 10 self-isolation orders were issued to people who arrived at the New Brunswick border without proof of vaccination, and 1 compliance order was issued in Moncton. In connection with care required when checking proof of vaccination at a venue where vaccination proof is required. As part of these inspections, peace officers visited 63 places of worship to ensure they were following the rules. I was pleased to learn that 62 of the 63 locations that were inspected were in full compliance of the rules. Non-compliance was found at only 1 location, His Tabernacle Family Church on Rockland Road in St. John. Investigations are ongoing and matters are before the courts. I am deeply appreciative that nearly every religious leader and faith community in New Brunswick is doing the right thing by keeping their community and their province safe. They are requiring proof of vaccination or having smaller, distanced mass gatherings, or they are taking their celebrations online temporarily. These are tough decisions, but necessary ones, and I appreciate the leadership that is being shown. We all know that our province continues to face a very serious situation. Hospitals across the province are feeling this strain. Last week, Horizon and Vitalite Health Networks announced that all hospitals and healthcare facilities will return to red level protocols beginning today for Vitalite and tomorrow for Horizon. These measures are being introduced in part to address the strain that has been placed on healthcare workers. These measures are already in place at the Campbellton Regional Hospital due to an in-hospital outbreak. And already, visitors are not permitted in hospitals in either health network. For Horizon facilities, these measures will be in place for at least 2 weeks and will mean that some non-urgent medical procedures and elective surgeries may be postponed, and non-urgent ambulatory outpatient clinics and professional service outpatient appointments may be postponed. All patients, clients, and support persons will continue to be screened for COVID-19 symptoms. Patients are asked to seek alternative options for non-urgent healthcare needs rather than presenting at an emergency department or urgent care center. At Vitalite facilities, all non-essential services will be reduced or temporarily suspended, including ambulatory care services, professional services such as physiotherapy, occupational therapy, and nutrition, non-urgent medical imaging services, and elective surgeries. Patients who are affected by these measures will be contacted directly. If you are not contacted, you should attend your scheduled appointment. In addition, Extramural Ambulance New Brunswick is moving to the red level of alert to help maintain essential services and ensure services are redeployed as needed. We will be assisting the regional health authorities as needed over the next few weeks as we work to reduce hospitalization and ICU admissions. For now, I am pleased to hear that nearly all hospitals continue to have capacity available to provide essential services. I know this impact on routine health services is very frustrating for those who have had an appointment or surgery postponed, and your frustration is completely understandable. I would like to emphasize that the health networks are taking these steps because they are necessary to get the situation under control as quickly as possible. I want to thank Horizon and Vitalite Health Networks for the commendable levels of cooperation they have shown under these challenging circumstances, including sharing resources as needed. And EMANB as well have really come to the table, and I want to commend all of the CEOs of these entities for working together to provide the best care that we can to New Brunswickers. Horizon recently, as of Friday, sent nurses to Campbellton to help offset their shortage of human health resources while they're undergoing their red level alert. I am hopeful that with the regulations currently in place, hospitalizations will begin to decline very soon, and these measures will not be necessary for long. I also want to thank all of the frontline healthcare workers, especially nurses, who have been especially impacted by this strain on our healthcare system. I know that you are working long hours and dealing with incredibly stressful situations. I truly appreciate the work you are doing to help all of New Brunswick. The Delta variant during the fourth wave of the pandemic has hit our province much harder than previous waves. We are all feeling this impact. The high case count and the high numbers of hospitalizations we have experienced in recent weeks has led to new measures coming into effect. A circuit breaker has been in place since Friday in several areas and will last 14 days. As a reminder, the impacted areas include Zone 1 as far north as and including Saint-Anne-de-Kent and including Havelock in Zone 2. The northern portion of Zone 3 from and including Deerville and Florenceville-Bristol, and all of Zone 4, including Meneville in Zone 5. A full list of all impacted communities can be found on the GNB coronavirus website. All New Brunswickers will be impacted by some restrictions, such as wearing a mask in indoor public spaces for the foreseeable future. These are the steps that are necessary to find a balance between living our lives as normally as possible while reducing the impact on our healthcare system. We are also exploring other ways to prevent the virus from spreading, such as expanding our use of rapid testing. These tests have already been made available to businesses through Chambers of Commerce. And starting today, rapid tests will be made available to unvaccinated students who have been identified as a close contact of a positive case to help reduce the time they need to self-isolate and minimize disruptions to learning. The COVID-19 pandemic is still evolving, and as always, we are continuing to evolve with it. I appreciate everyone's continued patience and cooperation as we face this latest challenge. By doing our part and by taking care of one another, I know we will make it through this fourth wave. Thank you. Merci.
Thank you, Minister. Dr. Russell. Merci beaucoup, Ministre Shepherd et Dr. Russell. Nous allons maintenant procéder aux questions période de questions avec les membres de médias. Vous avez le droit de poser votre question dans les langues officielles de votre choix. Chaque journaliste aura une question et un suivi très rapide. We will now proceed to questions with members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. On va commencer. We will begin with Frédéric Camarano, Radio-Canada.
Donc, bonjour. Ma question s'adresse à la médecin hygiéniste en chef. Donc, c'est l'arrivée aujourd'hui des tests rapides dans les écoles. La marche à suivre est encore un petit peu floue, donc j'aimerais que vous nous expliquiez étape par étape qu'est-ce qui arrive une fois qu'on confirme un cas dans une école pour ce qui est des tests rapides.
Les détails pour les tests puis comment ça marche, c'était fourni à les parents et à les administrateurs et les professeurs. Je crois que tous les détails sont en ligne pour que les gens puissent être capables de lire toutes les informations. Mais juste pour voir si j'avais des détails devant moi. Parce que c'est vraiment un nouvel processus et je l'ai trouvé. Bon, OK. Alors, le but de le programme, c'est vraiment d'être capable d'avoir les enfants, les élèves à l'école le plus que possible durant soit des éclosions ou soit quand des gens sont en contact avec des cas. Alors, le département d'éducation a collaboré avec le département de santé publique pour ce programme. Et à ce moment-ci, c'est vraiment aujourd'hui les étudiants qui sont pas vaccinés ou qui sont identifiés comme un contact étroit d'un cas confirmé, ils vont être fournis avec 5 à 15 jours de tests rapides. Et ça dépend sur la date d'exposition à la cas confirmé. Et comme je vous dis, toutes les instructions, tous les détails sont donnés à les parents et les tests peuvent être envoyés à la maison avec les étudiants ou ils peuvent être ramassés par les parents la prochaine journée, dépendant quand l'école avait donné l'indication que l'élève était un contact étroit d'un cas confirmé. Les élèves qui sont pas vaccinés seront dirigés de auto-isoler pendant 24 heures pendant qu'ils prennent leurs 2 premiers tests rapides. Et ça, c'est le cas, sauf que si Santé publique donne d'autres directions, c'est Santé publique qui dirigeait si oui ou non les étudiants seront capables de retourner à l'école après qu'ils ont eu leurs 2 tests négatifs rapides. Et s'ils n'ont pas des symptômes, alors ils vont être ils seront obligés de continuer à avoir des tests chaque jour jusqu'à temps la fin de la période qui était prescrite par la santé publique, avec les instructions, avec les directions qu'ils ont reçues avec les tests pour continuer d'être capable d'aller à l'école. Et les étudiants et les employés de l'école, s'ils sont vaccinés, oui ou non, il n'y a pas de différence. Eux, ils devraient rester à la maison et ils devraient avoir un test PCR. Alors, pas les tests rapides. Et ça va être fait à travers de santé publique. Et s'ils ont reçu directions qui sont contact étroit et même s'ils ont seulement un symptôme. Alors, moi, je vais répéter tout ça en anglais parce que je sais qu'il y a des gens qui écoutent qui aimeraient avoir toute cette information en anglais aussi. So the rapid testing program is underway in schools, and the Department of Education and Early Childhood Development collaborated with Public Health to develop this new rapid testing program for schools to help minimize disruptions to learning due to COVID-19 outbreaks. So beginning today, unvaccinated students who are identified as a close contact of a confirmed case will be provided with a 5 to 15-day supply of rapid tests, depending on the last possible exposure date to the confirmed case, along with instructions. So the tests may be sent home with the students or picked up by parents the following day, depending on when the school is notified of the confirmed case. And so unvaccinated students will be required to self-isolate for a period of at least 24 hours while they take their first 2 rapid tests. Unless they're otherwise directed by public health, those students will be able to return to school once they have recorded 2 negative tests and if they have no symptoms. They will be required to continue to test daily until the end of the period as prescribed by public health through instructions that they will receive with the kits to continue to attend school. Students and staff, regardless of vaccination status, must stay home and get a PCR test through public health if they have received notification that they are a close contact and have even one symptom.
Merci beaucoup. Monsieur Camarano, as-tu un suivi?
Oui, j'aimerais savoir si toutes les écoles sont prêtes et si on a déjà ces tests rapides prêts pour toutes les écoles.
L'information que j'ai à ce moment-ci, c'était tous les tests sont en train d'être distribués à ce moment-ci. Alors, je crois que ça veut dire qu'il y aura des écoles qui n'ont pas pu commencer aujourd'hui, mais dès que possible, ils vont commencer.
Docteur, merci, M. Camarano. Maya, Radio-Canada.
Oui, bonjour. Est-ce qu'on m'entend comme il faut?
Oui.
Ma question porte en fait sur les femmes enceintes. Est-ce qu'on en voit qui sont hospitalisées ou qui sont aux soins intensifs ou on en a vu dans les dernières semaines? Est-ce qu'on a des chiffres là-dessus?
Alors, j'ai pas des informations, des chiffres actuels ici au Nouveau-Brunswick, mais je peux vous dire que les risques sont très, très, très élevés chez les femmes qui sont enceintes. Et il y a d'autres endroits ici au Canada où les dames qui sont enceintes, qui sont pas vaccinées, qui ont eu le COVID-19 et qui sont ils ont eu des symptômes sévères, ça nécessitait d'être admis aux soins intensifs ou à l'hôpital. Il y a des femmes qui aussi ont décédé avant que qui ont accouché. C'est vraiment important que les femmes qui sont enceintes soient vaccinées le plus vite que possible.
Maya, as-tu un suivi? Maya?
Excusez-moi, la connexion a coupé.
As-tu une deuxième question rapide?
Oui, juste la connexion a coupé. Je ne sais pas si c'est juste pour moi, mais j'ai pas entendu la fin de la réponse. Mais donc, j'ai pas vraiment de questions, mais juste pour valider. Donc, on ne sait pas s'il y a des femmes enceintes qui sont hospitalisées ou qui ont été hospitalisées dans les dernières semaines. Dr. Russell, c'est ça, si j'ai bien compris?
J'ai pas de l'information sur le nombre de femmes qui sont enceintes qui ont été hospitalisées. Je peux seulement vous dire que le risque est très élevé parmi les femmes qui ne sont pas faites vacciner encore, qui sont enceintes à ce moment-ci.
Merci beaucoup.
Merci.
Justin Dupuis, l'Acadie Nouvelle.
Oui, ma question pour Mme Russell. Je voulais savoir, depuis un mois, on a vu que le nombre de gens pleinement vaccinés qui ont été infectés par la COVID a quand même augmenté de manière importante au Nouveau-Brunswick. Puis je voulais savoir si vous savez pourquoi. Est-ce que vous pensez que c'est en raison de la diminution de la protection contre l'infection que les conférée par les vaccins? Est-ce que c'est cette raison-là? Parce que c'est quelque chose qui a été observé ailleurs. Donc, je voulais voir si vous aviez des hypothèses à ce sujet.
Alors, comme vous le savez, le vaccin contre la COVID-19, ça protège contre les symptômes sévères, ça protège contre la nécessité d'être admis à les soins intensifs et ça protège contre les décès. Ça ne veut pas dire que vous ne pouvez pas quand même attraper le COVID-19 quand vous êtes vacciné pleinement, mais ça veut dire que si vous devenez positif pour le COVID-19, les symptômes seraient presque pas là du tout ou ça serait très faible. Alors, fur et à mesure que la population est pleinement vaccinée, fur et à mesure que le taux de vaccination parmi les Néo-Brunswickois et Néo-Brunswickoises augmente, ça veut dire que la plupart des cas se retrouvera parmi les gens qui sont doublement vaccinés, mais on espère qu'on ne verra pas le même nombre de cas qui sont hospitalisés à ce moment-là.
Monsieur Dupuis, as-tu un suivi?
Je suis juste curieux de savoir, la médecin hygiéniste en chef des territoires du Nord-Ouest disait la semaine dernière que justement, il y avait de plus en plus de cas chez les gens pleinement vaccinés, puis qu'il faudrait peut-être envisager l'administration d'une 3e dose à l'échelle canadienne assez bientôt. Je ne sais pas si est-ce qu'on en est là au Nouveau-Brunswick ou c'est encore trop tôt pour savoir qu'est-ce qu'il en est d'une 3e dose.
Oui, absolument. Ça, c'est des discussions qu'on a chaque semaine avec nos collègues dans les autres provinces et aussi avec l'Agence de santé publique du Canada. Alors, on est prêt à lancer notre campagne pour des 3e doses, mais pour commencer, vraiment, on suit les directions de le Comité national sur les vaccins et pour cette population, c'est ceux vraiment qui sont admis dans les soins long terme, qui ont été vaccinés dans le mois de décembre et janvier au premier, et les gens particulièrement qui ont eu l'intervalle entre les 2 doses, il y a plus de protection avec ceux c'était 16 semaines entre les 2 doses. Ceux qui ont seulement eu 28 jours entre les 2 doses, c'est plus à risque. Mais on commence les 3e doses 7 semaines pour les aînés.
Merci beaucoup, M. Dupuis.
Merci,
Doctor. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Yesterday's press release mentioned that a person in the 19 and under age group is in hospital being treated for COVID-19. Now, I understand there are privacy issues, but do you have an update on how this person is doing, and are you able to tell us any more information, such as is it the Delta variant, and was this person vaccinated?
Hi, Vicki. I unfortunately can't give any updated information around that particular case. All I can say is that it's not very common to have somebody in that age group in hospital. So we'll share information as we can. But the message really is if you, regardless of your vaccination status, we know that you can get COVID-19. We just assume that you'll have a much milder form of it and won't require hospitalization. And we are presuming at this point in time that all cases are Delta.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
Thank you, I do. Of the fully vaccinated people who've contracted COVID-19, especially those who've ended up in hospital, are we recording data about what vaccine they received and when? And also, are you finding any other common threads in general that you've noticed among hospitalized, fully vaccinated people, such as underlying conditions or age groups?
We haven't analyzed all of that data yet, but we are collecting it. You are correct. And each province is doing their vaccine efficacy work right now. But in a general sense, based on data from other provinces, the breakthrough cases, again, you can see as the population receives their 2 doses and that percentage of the population increases, most cases will be among people who have 2 vaccines. With respect to those double vaccinated individuals who then require hospitalization, there are many factors that are at play. One, their age, and immunity is affected by age. 2, when they received their vaccination. So, if it's more than 6 months prior to that, and if the interval between the first dose and the second dose is shorter, so that 21 or 28 day period interval increases the risk of immunity waning compared to the 16-week interval. So there are many factors at play, people with immune-compromised conditions, et cetera. So there are other chronic diseases that can decrease your immune system as well.
Thank you both. Andrew Waugh, Brunswick News.
Hi. First, I'd like to get a little bit of clarity on the average length of hospital stays for COVID patients, because we've heard 5 days, we've heard 17 days. And I'd also like to know if the province is tracking readmission rates of COVID-19 patients? I ask because Alberta is seeing a pretty big spike in readmissions.
Hi, Andrew. So for the second question, I haven't seen, based on all the data that have been presented here in New Brunswick, that there have been readmissions for COVID. So that's to answer your second question. The first question, sorry, could you repeat the first question?
I think at one point, and it was you and Minister Shepherd, one of you said the average stays about 5 days. And
yes.
17.
Yep.
I just wonder which one it is.
I'm sure we have that data, Andrew. I just don't have it in front of me. So I don't know if Minister Shepherd has it off the top of her head, but we can get it for you.
Okay.
Top of my head.
Your follow-up?
Yeah. This one's for Dr. Russell. Dr. Russell, since the pandemic began, have you disagreed with any of the government's decisions? And if so, what decisions have you disagreed with?
Well, Andrew, as you know, with respect to the process for all policies that are decided upon by Cabinet, all of those discussions are confidential.
Well, we've had other chief medical health officers from different provinces publicly say, I don't agree with what the government's saying here. That's why I'm asking. I don't think your opinion is subject to Cabinet confidentiality.
Well, we can agree to disagree, Andrew, but I won't be breaching Cabinet confidentiality.
Thank
you. So just be clear, you're refusing to say whether you disagree with any of the government's decisions.
I'm saying that I support Cabinet confidentiality.
Thank you both. Laura Brown, CTV.
Hi there. I know you've already released some modeling on hospitalizations, but just in the numbers over the last 24 hours, you've seen 7 more hospitalizations and 7 more in the ICU, I believe. I'm wondering, can you describe how bad this is going to get for hospitals, or the predicted, what is predicted for hospitalizations, since you've repeated we really won't see the results of the public health measures for another week or so?
Hi, Laura. I can barely hear you, but I get the gist of your question. It's really around projections for hospitalizations and ICU admissions over the course of the next several weeks, and whether public health measures that are in place currently will be enough to impact the number of cases and hospitalizations. So I'll attempt to answer that, and then if Minister Shepherd wants to add, we can do that. We do work with our epidemiologists quite closely. We meet daily with all of the important stakeholders, including the CEOs of both hospital systems, of both RHAs and Ambulance New Brunswick and EMP. So as of right now, the projections are such that I think we're not able to predict a downturn quite yet. We are waiting for probably another 7 days before we see the cases start to drop, and there'll be a lag time after that, at that time, for when the hospital admissions will start to drop.
I think the only thing I could add to that is that even as early as this morning in a briefing, we talked about knowing that we're probably going to have a 6% increase in cases hospitalized over the next week. So that actually is less than what was predicted, let's say a week ago, at about 13%. And it could have gone as high as 30% without measures being taken. So we're constantly aware of where this is going to go, and the CEOs of Vitalite, Horizon, and EMA and B are in constant communication to manage resources.
Thank you both. Ms. Brown, do you have a follow-up?
Yes, I hope this sounds better.
Yes.
I'll try to speak up. I'm wondering if there was any transfer of patients from one hospital to the COVID patients from one hospital to another. I did spot that Upper River Valley is at 115% capacity at this time.
Are you asking if there have been transfers, or would there be transfers? Because the answer is yes, there would be transfers if they were necessary. We definitely try to avoid that. But the hospital, the regional health authorities, again, they're working really closely together to make sure that all the human resources are managed to be able to look after the current admissions right now that are COVID positive.
Thank you. Thank you both. Sarah Deary, Radio-Canada.
Oui, donc ma question est d'abord pour Dr. Russell. Après l'entrée en vigueur de l'état d'urgence, vous parliez déjà d'attendre une semaine au moins avant de voir le nombre de cas baisser. On n'a pas vu le nombre de cas baisser. Là, vous parlez encore d'une semaine pour les mesures coupe-circuit, les mesures supplémentaires. Comment être certain en ce moment que c'est assez les décisions qui ont été prises?
Ben, je crois que ça nous encouragerait si on voit pas les nombres de cas augmenter, mais c'est possible que les nombres d'hospitalisations peuvent encore augmenter parce que on voit que le temps après qu'on voit le nombre de cas augmenter, les nombres de cas qui sont actifs maintenant, que ça va prendre une couple de jours après ça, qu'on va voir si les gens ont besoin d'être hospitalisés. Fur et à mesure qu'on augmenterait notre taux de vaccination parmi la population avec 2 doses, ça va nous aider aussi en même temps. Mais vraiment, les gens doivent vraiment suivre les directions de santé publique. Ils doivent rester, garder leur nombre de contacts étroits le plus bas que possible, laver les mains, la distanciation physique et porter les masques. On a beaucoup de travail à faire ensemble pour essayer de diminuer les nombres de cas à ce moment-ci, mais ça prend l'effort de toute la population.
Merci, docteur. Sarah, as-tu suivi cet après-midi?
Oui, pour la ministre de la Santé, c'est pour savoir, dans le fond, l'alerte rouge dans les réseaux de santé est là aussi parce qu'il y a un manque de personnel. C'était le cas avant la pandémie. Puis il y a des conséquences directes avec le délestage dans les hôpitaux. Est-ce qu'il y a une solution concrète qui va être proposée sous peu? On attend notamment le rapport de la réforme de la santé.
Well, I appreciate the question. And yes, you're right. Human Health Resources has certainly been pre-pandemic. However, the Campbellton situation is actually the result of an in-house outbreak. And so the hospital itself has had an outbreak within its facility. And so it has resulted in many of their medical professionals being sent home to have to isolate until they are either cleared or go through the process of being COVID infected and having to work through that. Right now, we have 228 healthcare workers out in the system. And so you can imagine that with a healthcare system who is challenged, not unlike any other province in this country, with human health resources, that puts a burden on all those who are left behind to fill the workloads. I also want to say that yes, I believe when we table the health plan later this month, you are going to see an urgent action plan to address human health resources and our healthcare system as a whole.
Beaucoup.
Merci.
Merci à vous. Ailish Bonang, CTV.
Thanks, Bruce. My question is for either, actually. I've been speaking with fully vaccinated students who have been considered close contacts of cases in their schools, and they're telling me that they're feeling quite a bit of anxiety around the fact that they're not expected to isolate if they're symptom-free, nor can they take part in the new rapid testing program through the schools. I definitely understand the worry of running out of testing kits, as Minister Cardy mentioned last week, but where vaccinations don't equal full protection, as both of you have said today, would it not make sense to get ahead of these possible cases with testing for everyone who wants it?
I'll start, and then if Minister Shepherd wants to add. So we work really closely with education in terms of formulating our plan for this program. And it's an evolving process because as we roll it out, we do hear feedback like this, but we also continuously look at the risks on a day-to-day basis. So the risks of unvaccinated students versus vaccinated students, the risks of missing cases, as you mentioned, we don't want to miss anyone. So it's taking that all into account and balancing that, but we will continue to work hard to improve whatever needs to be improved in this plan, because we're in constant discussion, again, with education, and the medical officers of health have input regularly on identifying risks and managing those risks.
I'm going to just add to that every single day I am impressed with public health and their team of contact tracers who work through this incredibly difficult process of ensuring that we get as many people as possible and notify them if they've been a close contact. And I can't applaud their work enough. They have worked through every single holiday, Thanksgiving to just recently, and they're doing it because they know that it's one of the best tools we have in controlling the spread of COVID-19. And so as this process unfolds, I think we put faith in public health that they're getting pretty good at doing this work, and in knowing how they need to respond to any kind of an outbreak, whether it be a school or a long-term care facility or a nursing home. So we need to put some faith in them that they know what they're doing. And I believe that, we've always balanced this approach in how we put policies in place. And I think that they look at it every single day to see if there needs to be an adjustment.
Follow up.
Yes, thank you. Has there been any contemplation about sending kids under 12 who obviously can't be vaccinated to a learn from home model anytime in the last 2 weeks? And if not, what conditions would be considered critical enough to do so?
I think I'm going to have to defer that question to the Department of ECD just so that you would have clarity in the answer. I'm not aware of those discussions. But it would be really up to Minister Carty to give you that information for sure.
Thank you.
Thank you.
Tim Roselle, Global TV.
Thank you, Bruce. My first question is for Minister Shepherd, although Dr. Russell can weigh in as well if the suit fits, so to speak. Minister Shepherd, you mentioned that the province is considering expanding the use of rapid tests, and I'm wondering if you can actually expand on your note there, and perhaps address in what areas the province is looking to expand and how that expansion may work.
Well, I'm not sure if I could give you proof positive answers, and Dr. Russell may have some information here, but there have been questions about whether or not we could use them. If we could use them for certain medical appointments, if we can ensure the continuity of services in using them, but they will all be based on supply. And I don't know if Dr. Russell has anything more to say to that.
Yeah, we definitely are having those conversations in terms of how to expand that program. I will say that obviously working with the Chambers of Commerce around the province in terms of the first rollout of these tests has been quite successful. There have been some hiccups along the way that, again, we're working through. One of them happens to be that we are hearing about people who may have access to point-of-care tests, but don't actually understand how to use them appropriately in terms of when to notify public health if you are positive, and making sure that you do all the things that public health needs you to do if you do have one of the test kits. So I would just caution anybody who does have them that didn't get them through the Chamber of Commerce program. There are certain criteria and pieces of information that are quite critical to be able to use these tests appropriately.
Roselle, do you have a follow-up?
I do, and it's for Dr. Russell, please. Dr. Russell, you had addressed in your remarks the increasing number of COVID-19 positive cases that are in vaccinated people or being discovered in vaccinated people. Are you concerned at all that those rising numbers may dissuade people from getting vaccinated if they're on the fence, or even some people that may have gotten their first dose may not go get their second one because they see numbers like we saw yesterday where it was an almost 50-50 split for new cases of people being vaccinated and unvaccinated. So are you concerned that those increasing numbers among the people who are vaccinated may be a deterrent for people who are considering?
Absolutely, Tim. That's why we're trying to frame the risks and put everything into context with respect to those numbers. So we will definitely see the number of double vaccinated people with COVID-19. We will see those case numbers rise, there's no question. But what we won't see is we won't see a proportional rise in hospitalizations and ICU admission, because the COVID-19 vaccine, when you're doubly vaccinated, protects you about 95% against severe symptoms requiring hospitalization and ICU admission and death.
That concludes today's COVID-19 update for New Brunswick with Dr. Russell and Minister Shepherd. Just for a quick recap, there were 109 new cases of COVID-19 in New Brunswick today. As far as the health breakdowns go, they don't share those with us in the conference anymore. I will have those in a press release in just a few minutes' time that I'll be able to share with you on our Facebook page. I will be putting together a Newsbreak 26 for tonight around 7 p.m. So look for that online later today. I appreciate you watching with us. I'm Vicki Hogarth at the CHCO News Desk. I'll see you next time.
This has been a news and public affairs production of CHCO TV, New Brunswick's only source for independent community television.